Hello, this is the KDT standard belting procedure as far as the supine position. We're going to get the patient in here. We're going to instruct them to sit on the side of the belt on those two straps. They're going to spin and lie back on the table, repositioning themselves in the middle. Lie back. The knees will remain bent. You're going to bring up the bolsterless leg elevation system, have them rest the knees down. As a standard procedure for comfort, we take the ankle bolster, have the patient lift up the ankles. You slide that underneath just like that, ensuring comfort. The thoracic section here should be elevated slightly so the patient isn't just flat looking at the ceiling. In this flexion, the supine position is a flexion-oriented position, so that might make the patient more comfortable. You're going to start with your pelvic lumbar belt here. You have a handle loop, which you're going to pull across, hold pressure down here. You're going to grab the belt on this side, and you're going to snug it across. So there's no air spaces, but it's not too extremely tight for the patient. Next thing you're going to do is you're going to grab your 2-inch circumferential belt, and that is going to be put into place and tightened. The ring loop should be offset away from you slightly. It will come in and connect up into here. Then we're going to first take out the slack by pulling the tab down like that. We're going to put your right hand, if you're right-handed, underneath the strap here, and your left underneath the belt strap against the patient. Now it's like if you've ever done a horse saddle before as far as tightening, that's the motion. The top strap is pulled down while the bottom strap is forced up. So it's a simultaneous thing. You're going to tighten it down and cinch it. Just when you think it's tight enough, give it one more to make sure that it's tight. The second thing you're going to do then, after that, is you're going to put on your secondary cinch strap. This part will come underneath the ring loop, go up over, you connect it in place like that. Then you're going to take out the slack, and you're going to tighten that down as well. Just like that. At this point, you're going to bring up your tail strap here with your hook. Your hook's going to go underneath the ring loop. On the edge of the belt here, you have a handle. You put your hand through. This is for pre-tensioning the belt or removing the slack. You're going to pull on the bottom and pull on the top, making sure that that is tight in place. You have a dual ring loop here. The standard in supine and prone positioning always used to be the upper ring loop, but in the supine in the last few years we found it much more comfortable and more feasible if you attach both of the ring loops together. And what that also does is that will take off any ASIS pressure of the belt here, especially if you have more of the elderly patient population that's more bony, so it's more comfortable. And another thing too, it increases the perceived value of the pull. The patient specifically feels the low back stretching versus the whole lower part of the body moving towards the traction decompression head. Next thing is the thoracic wing vest. This will come underneath the patient's rib cage, and it will X right over top of the pelvic belt. So right across here and underneath like that. Make sure it's comfortable. Then the patient will take their arms and lie it down right on their belly just like that. That's it, simple and easy. As an alternative to a thoracic belt, you can use the KDT slipstop blocks. I already put this one on this side, but the skinny end always goes towards this front of the table in all the different setups. But this will go right underneath back of the rib cage. As long as patient weight is on there, they will stay in place up to about 70 pounds or so. So usually clinics will pick this as the fastest option if they're not pulling somebody too hard. So. Another option for the thoracic restraint in the supine position is the axilla posts that are fully adjustable and comfortable. They will slide on the edge of the table. The patient will lift up their arm here, and you're going to loosen the knob about a half a turn, and then we'll have adjustability. So the patient will put their arm down, you will slide it up into the axillary region here, and then you will tighten it into place. And as the patient slides, they will lock into place, and they won't create any slippage at all.